Hey guys, Dr. Mcclimon back with Spinal Hygiene Community, and I'm going to bring you a top tip today. This is something that I've just realized over 16 years of being in practice, and something that I think is really valuable in understanding and how it can help prevent low back pain and other types of back pain. And that is, most doctors do not evaluate leg length difference. Guys, there's a major epidemic I see today, and that is a large percentage of patients that come into the practice actually have an anatomically short leg. Now, you know I'm a chiropractor. I work on improving the structure of the spine, finding, detecting subluxation, and correcting that. And often that does correct a leg length imbalance. However, there are cases where the patient has an anatomically short leg and an adjustment is not going to correct that. So it needs to be addressed with a lift, with an orthotic, but we want to make sure we have a level foundation. Otherwise, that changes the complete gait cycle. It changes, you want an unlevel foundation in your house, and you don't want one in your body because it's just a negative chain reaction throughout the rest of the body, and certainly can contribute to low back and other types of back pain. So let me give an example. I'm going to show you now a patient, actually two patients that came in and examples of this. Okay, so let's just come over here, and we're going to show you this guy here first. So this guy comes in, and you can see he had, up top here, he had a 30 millimeter, okay, 30 millimeter deficiency on his right side. All right, so we worked on him. Some that did come out with adjustments, okay, and you can see how it came back to about 5 millimeters, and his curve had diminished 4 degrees. But you can definitely see the difference between there, okay, really significant imbalance in the pelvis. And if this isn't addressed with a lift, then that patient's left with an imbalance, and that's going to certainly affect the spine, affect the nervous system, affect ultimately the health of your body. Because remember, guys, the nerve chart controls every single function in your body. So, second patient here, guys. This is a guy, he came in and he had you can see here, he had a 10 millimeter deficiency in his leg, and you can certainly see the imbalance in the spine. Okay, so after we worked on him, okay, you can see now we have a level pelvis and a much straighter lumbar spine. This is going to significantly remove nerve interference. It's also going to eliminate or slow the process of degeneration in the spine because of having better structure. We don't get arthritis again, guys, because we're old. We get it because we have old misalignment. So again, we went from 10 there, guys, down to 0 and nice level spine. So you can see the difference there, guys. So yeah, I wanted to show you that because those are a couple of good examples of how we have an imbalance in the pelvis, which affects the lumbar spine. And often we have back pain, and we might address the symptom, but ultimately we're not addressing the underlying cause of that pain, which can be an anatomical difference in leg length. So if this is something that you have never had checked, or you've been suffering with pain and you feel like you're not getting better, it's definitely something worth looking at because it could be the underlying cause of your back pain and your problem. So that's something I've clinically seen over, again, 16 years. I really think it helps. It definitely helps a lot of patients in this office, and maybe it'll help you. So that's your tip of the week, guys, and we look forward to seeing you again soon.